So this is another brief data overview, September 2020, for data collected on the MSK tool and 7 PROMIS scales. So just a reminder of what the MSK tool measures. It's a stratification approach as opposed to a current wait and see treatment approach for MSK problems. So the proposed tool attempts to stratify patients based on the risk of a poor outcome, which has been defined in some other studies. And we can see here the questions and the scoring. Essentially, the questions have to do with pain, self-management, pain impact, some functional questions, walking, pain location, long-term expectations, other health problems, emotional well-being, fear, and then the duration of symptoms. And then you get a low risk, medium risk, and high risk score. The low risk score indicates that self-management, education, and advice, simple medications, or be appropriate treatment. A medium risk score indicates specialty care like physiotherapy or another type of interference or intervention. And then high risk suggests that they have kind of stronger analgesics, psychosocial approach to care, or other specialty. So for this particular trial, the patients were about 100. So we have 99 patients for the full data set. And essentially we did 7 different PROMIS scales and the MSK tool for patients attending 2 physical therapy clinics in Newburgh and McMinnville. And the PROMIS domains are listed here: satisfaction in social roles, anxiety, depression, fatigue, pain interference, physical function, self-efficacy, and then here's the MSK score. So the first thing we're showing you here is the means for the different PROMIS dimension measures. And remember that on all of these measures, 50 is the US average, or in the case of self-efficacy, is the average of people with other kinds of chronic conditions. So we can kind of see most of these scores deviate somewhat from 50, and the amount worse they are than normal or 50 is described here on the right. So the ones in black exceed a 5-point difference from normal. So those that stand out were anxiety. So patients had higher anxiety on average, higher pain interference by almost a standard deviation, and worse physical function by almost a standard deviation. And we can see that not reaching 5 but closer on average is fatigue and self-efficacy. And then the patient acceptable symptom state is a reference measure that we can use to kind of benchmark a scale that tells us at what point most patients find that level or severity of symptoms on that scale unacceptable. And so that's what we're tracking here. And so using this 55 as an example, 44% of the patients found themselves at having an unacceptable level of fatigue. 44% had an unacceptable level of pain interference. About 40% an unacceptable level of physical function, and again 44% unacceptable level of self-efficacy or confidence in managing their symptoms. So it just gives you an idea of what proportion of patients kind of fall in this range of definitely unacceptable on that particular scale. And then the ranges of scores on all the scales were full spectrum, so there were very few floor and ceiling effects on any of these scales. So in terms of the categorization on the MSK tool, we can see here is the low, medium, and high risk percentages, and we can see that about approximately a little less than half were low risk, and then a little over half were either medium or high risk on the MSK tool. Note that this isn't on their first visit, so some of the patients were attending follow-up visits or visits near their discharge. So in this data, we're showing you 2 things. We're showing you the prediction of the MSK category of high or medium risk versus low risk given the PROMIS domains. And the PROMIS domains are listed over here to the left. The receiver operator curve analysis is this first column, and the Spearman row correlations, the second column. So we can think of this as anything above 0.7 is significant, and above 0.8 is very good. So you can see that the physical scales, or the biomedical scales here that were physical function, pain, inference, and fatigue, were all above 0.7, and pain, inference, and fatigue were really above that 0.8 mark. And then in terms of mental health scales, only self-efficacy really was above 0.7, approaching 0.8. And then for social scales, the satisfaction with social roles was nearly 0.8. And so essentially pain interference, fatigue, and satisfaction with social roles kind of stand out in their association with the MSK tool amongst the 7 PROMIS scales. We can also look at the Spearman-Rowe correlations here, and you could say anything above 0.6 is significant. We can see again that the physical or biomedical scales, pain interference and fatigue, really are consistent with the receiver-operator curve analysis. And then the self-efficacy scale, it's a little below 0.6, and then satisfaction with social roles doesn't quite meet the 0.6 standard. And then if we look at a multivariate analysis here, where we kind of include all of the PROMIS physical domain scales to see if only the physical domain scales predict the MSK tool, we have an R-square of 0.46 with only pain interference and fatigue included, which were both significant. And then if we only use the mental health scales, depression and self-efficacy do pretty well with an R-square of 0.36. So that, and then this last model down here is if we take all of the PROMIS scales and ask which of any of the domains, the physical, the mental, or the social, kind of combine to predict MSK the best. Essentially, the role satisfaction with social roles and fatigue achieved the highest R-square of 0.48. So what this does is this just kind of tells us individually, really, that the physical performance and the social roles and self-efficacy are the best individual scales that predict MSK. And then when we look at different combinations, the physical scales alone do very well. The social roles and satisfaction and fatigue do very well. And then the social or mental health scales, and then the mental health scales can perform okay, but not as good as the physical or the combination of social roles and fatigue. So the second question is unrelated to predicting the MSK tool, is what's the patient experience completing these tools? And essentially we have about, if I remember right, something like 22 patients that we also surveyed. So here we had patients rank their experience completing the tools based on 4 questions as either strongly agree, neutral, or disagree. The first question was asked patients to reflect on whether the scales they just had completed, which was the PROMIS scales, had important information about their health. And you can see here 85% were above 0, and the average was 2.1. And the second question was, even though these scales don't mention my health problem, I could see how they could help the provider treat my case. And essentially, here, score went up with 95.2% above 0. And then the last one, was really just a global question about using PROs in general. It said, if my therapist will use them, I'm happy to fill them out. And the scores were even higher, but what's more interesting is they weren't universally high. So anyway, 81% were above 0. So what this suggests is that the patient experience completing these scales was positive overall. And the next question we can ask is, what was the provider experience, or how did the provider rate having this information in addition to their normal protocols? So here's how we presented the information to them. You can see it's a report card where or the average of the US population is in the middle. What we could see is that that's yellow, or kind of getting worse, but only slightly worse than average. And then when it became more than a standard deviation, worse than average, it turned yellow, and then we have their individual scores written here. So what providers were done is we presented this, quote, report card to them, and then we asked them to rank how helpful this was to know in terms of their overall treatment planning and care. And then they would give it a ranking. And so this particular one, we can see a lot of the psychosocial variables like depression and anxiety are being flagged as quite severe. And then even role satisfaction is low, and self-efficacy of symptom management is kind of moderate. So essentially this was helpful to the provider, likely because all these kind of psychosocial domains that they wouldn't normally assess were involved in this patient's case. So we can kind of see 58 different cases that occurred over, I think, approximately 5 therapists. We can see how they kind of ranked them, where about 30% of the scales or the report cards ended up in the 4 to 6 range of helpfulness, which is marginally helpful. 71% of the cases they ranked as 7 or higher. So indicating that a majority of the cases, had the potential to have a strong impact on patient care.